My name is Wanpracha Art Chavalit-Wongs. I'm here to talk about machine learning and artificial intelligence in healthcare system. I'm from University of Arkansas. I also work with colleagues with University of Washington. So I presented my work on machine learning, AI in medical imaging and medical signals with the hope that it can be applied to heart rhythm area, the field. The technologies have come a long way. Now we can use computing, machine learning, AI to help augment how we make our decisions. We can collect more data now with the big data. We have computing, GPU, CPU, everything has come a long way. So we are now ready to really use them to the best, to our best ability to fully utilize and help machine learn from our experience so that they can augment how we make our decision. Right, I worked on brain research. We have used machine learning and AI to trying to predict seizures from brain signals. We have tried to study abnormal connectivities in the brain from neurodegenerative disease. We use brain signals to study human performance and when we are susceptible to making mistakes. Our team used machine learning, deep learning, and AI in cancer research, in medical imaging. So we can help use to predict diagnosis of cancers. We can use the treatment, evaluate treatment deliveries of radiation therapy. AI or machine learning requires data, so we need human to teach the machine to do and learn all the things that we want them to learn. Think about when we raise our baby, right? Or children, when we want them to learn math, they have to practice with so many examples in the math. The same thing with healthcare. When we want to train the machine to learn how to diagnose conditions, then we want them to see a lot of the data, a lot of examples, so that the machine can be pretty accurate and can learn different conditions, different aspects of what's going on in humans, so then the machine can make an accurate decision. Right, so again, human is still, intelligence, the more intelligence, domain knowledge, experience. We cannot replace any of those. But at the same time, we have used machine to help augment our abilities, right? Because machine can do things faster. Machine can do things in parallel that human cannot do. So they're simply tools to help augment what we can do and speed up. So in a way, it's just our replica of our knowledge. Therefore, we have to teach them, and we need, like I said, more examples to teach them, and we need to understand how they make decisions, because at the end of the day, we want them to make the decision based on our domain knowledge, our experience. Therefore, we have to understand the machine. These days, people talk about interpretable AI, so we have to understand. We cannot simply treat the AI or machine learning as a black box. So when we use machine learning or AI to make decisions, we have to understand how they come about to make that decision or conclusion. Right, I want to thank the committee for extending this invitation. It is an absolute pleasure to be here. It's a great honor. I get to listen to many wonderful presentations and learn all the new things I've learned. It's such a great experience. And again, it's simply well done, and keep up the good work. Well, I think just bring more conferences like this. I think Thailand, we need, to bring together scientific discoveries, medical marvels, and all the things that we need to learn. I think this event has brought together many well-known researchers, medical researchers, clinicians in the area. So I'm very, very impressed with the way that this event has been organized.
Hi, my name is Natalia Troyanova. I'm a professor of biomedical engineering and a professor of medicine at Johns Hopkins University. I also co-direct the Alliance for Cardiovascular Diagnostic and Treatment Innovation at Johns Hopkins University, together with my clinical collaborator, Dr. Hugh Calkins. And the goal of our work and the work in my lab is to develop new technologies that can be implemented in the clinic to improve cardiac patient care. We particularly work on developing new approaches that combine engineering and medicine, as we see the future of medicine as one that employs heavily engineering approaches. In our approaches, we are trying to develop a virtual replica of the patient's heart. Every heart is different, the disease is different, the approaches for treatment can be different, and therefore developing a personalized approach for treatment and diagnostic that is based on engineering approaches that can be implemented in the clinic, can be developed with new technology, is actually going to help the patient population at large. What we specifically focus is on working on developing these digital replicas of the patient's heart, which incorporate the structural remodeling that can be revealed by imaging, such as LG MRI or CT scans, and we use these images as well as electrophysiological information to create a virtual replica of the functioning of this heart of the patient, and then we use that to predict what is the best treatment. In the session that I just presented, I showed our work on two specific approaches. One was a recently published paper in Nature Biomedical Engineering, in which we did a prospective clinical trial on 10 patients to demonstrate that we can have a simulation-driven ablation for these patients that have fibrotic substrate as manifested on the LG MRI. This first in-human clinical study of simulation-driven approach for ablation was really successful. We had of the 10 patients, only one had to come back to the clinic for a redo procedure, and it was only because the target that we predicted was not ablated at the first procedure. I also showed results in our simulation-driven ablation for VTs. We are working on predicting that in ischemic cardiomyopathy, what would be the most optimal way to ablate patients, and also working on predicting risk of sudden cardiac death in patients. We are working on patients with ischemic cardiomyopathy. We just published a paper on tetralogy of Fallot. We are working on hypertrophic cardiomyopathy and other non-ischemic cardiomyopathies. So the goal is to ultimately develop a suite of tools that are based on a digital replica of the patient's heart. And as this technology goes forward, we are hoping to not only base these models on the information from imaging and electrophysiological data, but we incorporate all kinds of clinical information, and we use not only simulations, but the tools of machine learning and artificial intelligence to come up with the best personalized diagnostic and treatment tools. A key message that I would have based from the outcome of our work is engineering is going to make very big strides in medicine, and the future doctors will be a blend of engineering and medicine. I want to thank the organizing committee of APHRS for not just only inviting me to present the work and giving an outlet of all the work that my lab has done and my collaborators, but I want to thank them for actually having an excellent organization, because I really felt this year that I was able to go from session to session and be able to hear more new research that I have heard at different meetings before. So I think that the organizing committee has done an excellent job inviting a broad range of different scientists to present new and exciting research. So thank you very much, organizing committee, for having me here and for allowing me to present our work. I really appreciate that.